Hello, this is David from DN Cognitive Counseling. Tonight I'm going to respond to Jen's question on the last video I did about the schools, whether we should reopen them or not, and it should not be a right or left issue. Tonight I'm going to actually be showing you the comments and some documentation to explain some of the things I said in the video, to answer some of Jen's comments and hopefully some of yours, because this is an issue that we are all struggling with today. The sad part is that none of us know what is going to be next, what can happen, what the situation is, and there's a lot of anxiety. So I always say, what can be known should be known. And I'm going to try to back up what I told you in the last video with some facts, so that hopefully it'll give you a little more sense of what I think is going on and why that's the case. But first, let's get to Jen's question. Okay. Jen says, hello and good evening. You said it's almost definite that coronavirus is airborne. Almost definite. Is that a scientific term? Now, Jen, I think it's a great question, and the fact is, I can't say to a scientific certainty that it's airborne. But I can tell you that I very much strongly believe it's airborne based upon the evidence and the things that I know. And I'm going to get to that in a second. It's terrible what happened to the teacher in Arizona, and I agree with everything you said. Health issues should not be discussed from the perspective of elections or political parties, nor should they be discussed or decided with any agenda other than what is in the best for the people of the country. Unfortunately, from what I understand about the teachers infected, because of the viruses left on the surface, they were sharing a classroom. The mask wouldn't matter if they were sharing surfaces without proper disinfecting in between. I sincerely do not understand why some of the public doesn't comprehend how the virus spreads, or maybe they just don't care. Either way, I don't get it. Well, Jen, I hate to say this to you. They actually did use proper precautions in between. The school was wiped down and the surfaces wiped down between the classes. It wasn't a situation that they were using them together. So that's the difficulty you're having there, and why I said I really do believe it was spread airborne, due to the fact that they were wearing masks, and again, not the N95 mask. They were wearing regular surgical masks. So I feel like the bigger issue is the lack of consistency, guidance, and leadership. I try to avoid political conversations because personally, I don't trust and dislike most politicians. But the fact that the leader of the country doesn't trust and agree with the medical professionals in charge of the pandemic causes a lot of confusion and distrust of the information being relayed to us. You yourself say that the masks we are being told to wear are not effective in preventing the virus. So while I don't all agree, I can't understand how people will think, well, why should I wear it then? The fact that the New York people were allowed to protest without masks and social distancing sends ginormous mixed signals to the public. The fact that the public doesn't trust the information they're receiving is an issue. Here's a link from the World Health Organization that states without a mechanical device in certain situation, COVID-19 is not airborne. But yet you stated it is almost definitely that it is. P.S. Surviving on the surface and passing through droplets is not the same as being airborne. The virus is brand new and there is no historical data for this which to rely on. So this is a learning experience for everyone involved. After more than 7 months of infections, there are educated inferences scientists can make, but the only accurate truth that there is no accurate truth. So I'm going to stop here at this point, Jen, for your first aspect of your comments, because you're saying things that are absolutely true, and you're saying things that I could absolutely say are not true. And I'm going to help you to break this down a little bit. Now, we have to understand what actually is going on from both a political standpoint as well as the professional standpoint that is going on with the politicians. So there's the medical standpoint of what the medication issues they're doing and what the medical teams are deciding, and then you have what's going on with the political. So I just wanted to hit you with this. 230, this is from July 7th of 2020. It's from the New York Times. 239 experts with one big claim: the coronavirus is airborne. The WHO has resisted mounting evidence that viral particles floating indoors and are infectious, some scientists say. The agency maintains the research is still inconclusive. The coronavirus is finding new victims worldwide in bars, restaurants, office, markets, casinos, giving rise to frightening clusters and infections that increasingly confirm that many scientists have been saying for months. The virus lingers in the air indoors, infecting those nearby. If airborne transmission is a significant factor in the pandemic, especially in crowded spaces with poor ventilation, the consequences for containing them will be significant. Masks may be needed indoors, even in social distancing. Healthcare workers may need the N95 masks that filter out the smallest respiratory droplets that they carry for coronavirus patients. Ventilator systems in school, nursing homes, residents, and businesses may need to minimize recirculated air and add powerful new filters. Ultraviolet lights may be needed to kill the virus, particles floating in teeny droplet indoors. The World Health Organization has long held the coronavirus is spread primarily through large droplets. The ones expelled by infected people and cough sneezes fall quickly to the floor. And they basically, I'm not going to go through the rest of the article, which goes through why they believe what they believe. But Jen, I'm going to share with you why I believe what I believe. And the fact is, I work in the industry, and I have a lot of clients who work with actual patients, and they used PPE. They were making sure the surfaces were cleaned. They were wearing surgical masks, especially in the beginning. And the people that I know either got infected or had now have antibodies for this virus. Now, the only way that could have happened is through airborne, because they were using universal precautions to prevent them from getting it. And because of the fact that they've been infected, and they didn't, thank God they didn't get sick, but they were infected, that I believe, based upon what I know about this virus, that it had to be airborne. I also saw the difference when SARS came around as opposed to corona. SARS traveled through symptomatic people who were coughing and sneezing, and we were very good at curtailing SARS. And when I saw that we used the same protocol in the hospital, and it did not stop this, in fact, it kept increasing, I realized something was very different about this. And I did realize very, very early on. And it's not because I'm a genius or anything of that nature. I just recognize the difference between the two pandemics. And SARS, we were able to get through people who they were only transmitting when they were symptomatic. And by the way, in the beginning, the WHO said, asymptomatic, can people pass it? That turned to be false. They said it wasn't airborne. That turned to be false. You said about the idea of masks. Dr. Fauci actually went ahead in the beginning of this pandemic and said masks were not necessary, if you remember that. Well, there was an article explaining Dr. Fauci. This is from June 16th of 2020. Fauci, why the public wasn't told to wear masks when the coronavirus pandemic began. Now remember, we're talking about people's lives here. We're talking about a virus, and why Dr. Fauci said don't wear masks. Medical masks and cloth face coverings are now common sights when venturing out in the public amidst the coronavirus pandemic. Most states require them as part of the reopening plans, and the U.S. Center for Disease Control and Prevention advocates their use. This wasn't always the case. When the coronavirus pandemic hit stateside, face masks were strictly recommended as personal protective equipment, PPE, for healthcare professionals. According to Dr. Fauci, the nation's leading infectious disease expert and the key member of the White House Coronavirus Task Force, masks weren't advised to the public from the start because of the anticipated PPE shortages. Let me repeat that again. Masks weren't advised to the public from the start because of the anticipated PPE shortages. Speaking on the street, Fauci discussed how effective face masks are at preventing COVID-19 infections and why they weren't recommended from the start. Masks are not 100% protective. However, they certainly are better than not wearing a mask, both to prevent you, if you happen to be a person who maybe feels well, but has asymptomatic infections that you don't even know about, to prevent you from infecting somebody else, Fauci said. But also, it can protect you to a certain degree, not 100%, in protecting you from getting infected from someone who's either breathing or coughing or sneezing or singing or whatever, in which the droplets or the aerosols, this is, again, very important word, go out. So masks work, Fauci added. It's important in actual physical separations. It's an important thing in actually physical separation, Fauci said, adding the combination of social distancing and face masks is the best way for the public to mitigate the spread and reduce the transmission while maintaining some normalcy by adventuring in the public. So, Jen, to answer those questions, Dr. Fauci is explaining in very great detail that he stated not to wear the mask in order to stop shortages. It had nothing to do with the fact that masks were not effective or they didn't think masks would be effective. They were trying to curb the public from grabbing all the masks so that the hospital workers wouldn't have them. And that's the decision they made. Now, this put the public at much greater risk because now the public didn't have the right information and it put them in a bind of not being able to have what they need. And then this thing spread and killed a lot of people. So when you say, why is it that you just don't believe the experts? This is part of the reason, is that the experts sometimes know what's going on, but they don't tell you things for different reasons. Sometimes they don't want to panic. Sometimes they don't want people being upset. Sometimes they don't want people taking materials or hoarding. And because of, they don't want to make panic. Like I said, panic already. But the aspect is that we want to understand that we know that masks lower the infection rate. It lowers it, the mask for the surgical masks lower it much more from the person who's asymptomatic giving it to other people than you getting it. So if everybody's wearing them, then it stops asymptomatic people from getting it. It also provides a smaller amount of protection for the person who's wearing it themselves. But the N95 mask is much, much better. And as it says, stops it even if it's aerosol. Because Dr. Fauci knows, and probably he himself probably suspects, that this was probably an airborne virus as well. And again, not because of any other reason, that this is what the data seems to denote. Like you mentioned about these teachers, that they didn't wipe down the place and keep it disinfected between them, they actually did. Jen continues, there was a politician who tweeted something to the effect that there'll be a rally, no mask required, and in the capital letters he wrote, people are fed up. Sometime later, his staff tweeted that he was in the hospital infected with COVID-19, and I could think was, duh, WTF, did you think that would happen? You're right when you said you didn't have the answers too, because there is no answer. It's all opinion and conjecture. I don't agree with you. It's not all opinion and conjecture. I think there is educated guesses based upon the facts. And if you have enough of the facts, you could actually put this picture together. And about who thinks who's better, and that is tainted with politics. And I will tell you, the facts that I'm giving you is not tainted by any political point of view. I'm not pro or against anybody in terms of reference to this. I am more about the idea of understanding how this actually is working and what the decisions will be made. To me, the questions are simple. Will the masks help prevent the spread of the virus? Yes or no? The answer is definitely yes. Not percentages, not guesses, not opinions. No, you're wrong about that again. It is about percentages. Because anything you do, if you put on a condom for safe sex, you are not 100% protected from condoms with safe sex. You are 90-something% protected, which means that you could still get it. If you take the pill to not get pregnant, it is not 100% effective that you will not get pregnant. So percentages matter. And the more people wearing masks, the percentage goes down. So you put in the next part, nothing is 100% guaranteed, so looking for a guarantee is irrational, logical. You're 100% correct about that. Will opening schools assist in the spread of the virus? I will have to say to you, the unequivocal answer to that is yes. Not percentage, not guessing, not opinions. No, fact. Take a look at the case of the kids in the camp. That's what's going to happen in the schools. That's a fact. The schools will perpetuate the increase in the virus. What are the repercussions of opening schools? Now that is the bigger question. I don't know the answer to that question. I don't know if anybody can know the answer, and that's why I mentioned about the actuaries. Economically, socially, educationally, what are the repercussions for wearing masks? Economically, socially, environmentally. Again, that's a great question. What are the repercussions of wearing the masks? And again, I think there's a lot of questions about that as well. I know there's some issues about what's going to happen with carbon dioxide and whether or not you take in too much carbon dioxide. What are the repercussions for opening businesses, economically, environmentally? Again, that goes back to the question of what I mentioned about the actuaries. People who are qualified to do so need to compare these answers and determine the bigger detriment of the country. Now, again, this is where it gets hairy. How much is a life worth? How many lives are worth how much money? This gets very, very hairy. And again, I'm not saying this is an easy answer, not an easy aspect of this to be able to determine. All I can say is that we have to understand that these questions are the questions. That what you're asking is exactly what I was referring to in the first video. But when you say people are qualified to do this, people who are qualified to do this are going to have agendas a lot of times. In my opinion, if you're not an economist, actually, or a medical professional whose specialty is contagious disease, your opinion doesn't matter any more than my 4-year-old opinion would matter. Now that, again, I disagree with you. I had a lot of opinions about this virus from day one, and it turned out to be correct, almost every single one. And I had people in where I work, and they're all saying, how did you know? And it was very simple. I think there is things that we can know. I don't believe that the experts always know. When Dr. Fauci said that the masks were not necessary, I told people that's insane, right away. And then later you heard the reason why. So please, you want to tell me I'm wrong about something, that's fine. But to say that my opinion is like a 4-year-old, that's not true. I have been more correct on this issue than almost anybody else in terms of the media or anything they've said, not because of arrogance, but because I'm looking at what's actually happening, understanding how cases are manifesting, and going, how is this possible to happen? And I'm not doing it based upon only being able to prove it from a scientific standpoint, just sort of like deductive reasoning. If you see the case that happened near Seattle of the choir, and it happened very early on, where there was one asymptomatic person came in and 57 people tested positive after a 2-hour singing lesson, where they were socially distancing and they were doing all of this stuff and washing their hands and nobody had a fever. I knew at that point it had to be asymptomatic and traveling in the air. It's the only way possible. There was no idea of anybody touching anything for anybody to have touched the same thing, and those 57 people didn't come in contact with each other. So there are things you can deduce based upon facts when you know what the facts are of certain cases. We need to give voices only to those who are qualified to have an opinion. Again, I don't agree with you. Dr. Fauci is a very, very smart man. He's very qualified to have an opinion. He told you not to wear masks early on, and you heard his reason why. If you like to live your life that way, you can. I don't believe in helping people to live that way. I was telling people right away, you need to wear masks. Let me tell you why. Now, again, Dr. Fauci would say to you now, I was right and he was wrong. Not wrong in what he said. He wanted you not to. But he was worried about you buying up too many masks and taking it away from the hospitals. I was more worried about people dying in the immediacy. But again, you may disagree with me and say the hospitals should have been funded better or taken care of better, or whatever they had to do to get them what their needs were. But the public shouldn't have to suffer from it. Or you may say, no, the public should have to suffer for the aspects of the hospitals. That woman on the second video infuriated me with her comments because it was clear she had an agenda. Science doesn't have an agenda. Economy, statistics doesn't have an agenda. These are the facts, data, and that's what it is. Actually, everybody on the video I sent you had an agenda, and that was the reason why I showed both points. Because they both had agendas, and the questions that they asked, how they asked the questions, and what their focuses were. They were both had an agenda. At some point, someone is going to have to decide if the country can handle the shutdown of industry from an economical, social, and educational standpoint. Either the repercussions of the closure is worth the medical risk, or it isn't. I'd be elated if we just own the situation and the decision explaining and justifying with statistics and data, not opinion and conjecture and assumptions of election results. Again, and this is why it's so important to understand, we like to think about science being without anybody's agendas, and that people will approach science from an objective standpoint. The sad part is we're seeing over and over again that's not the case. The scientific community has been inundated with agenda, political ideology that has stopped people from being able to do science and attacked. I don't know if you know Steven Pinker. Steven Pinker is a social psychologist for Harvard. He's very brilliant and works on gender studies, discussing the differences between men and women. And because there's a certain political group that doesn't want to associate there are any differences between men and women, he has been now attacked, and they're going after him and claiming that everything he's done is biased, and they've slurred his name, trying to cancel him. Brett Weinstein is another professor he's been fired. There were two professors who did a whole study on gender studies where they published false works on purpose to show that when they did it in one direction, that it was published, even though it was quote-unquote peer-reviewed, but it was abject lies. And they showed that the quote-unquote science was just accepted without any review because it fulfilled an agenda. So the idea that you want to state that there's an objective science today without any politics is not true. Even in climate science, they found that there were people who they fudged their data to point a certain point of view. This came out, I think, a year and a half ago, where they found out that there was the issue that they were fudging data in order to put a political agenda with their mindset of we're trying to save the world. So this aspect of that, we can't deal with our thoughts and opinions and what we think is irrelevant. I don't agree with you at all. I think we as thinking human beings have the ability to make decisions and see what goes on, and we have the ability to decide what is in our best interest or not. The 30-year-old in Texas who said he went to a party and went to a coronavirus party thinking that he's going to be safe because he's young, and then before he died said maybe that wasn't such a good idea. That is a life lesson for many people to pick up on and see. And I don't think that you need science to be able to learn from that lesson. I think we can learn from other people and situations. I think that statistics and data can be played around with. As if you saw the video I did with Candace Owens and Mark Lamont Hill, they were going back with statistics and data, and they were going back with true statistics and data, drawing very different conclusions based upon that, based upon the way that you view it. So you could always look at things in different ways and use statistics and data for points of view. So to say that these objective things that you could just look at with no problems and just get to a right answer, I don't agree with either. And when I said that this is a very complex a conclusion that we have to come up with, I was saying it because I understand the two sides. And even with understanding it, I don't know what the right answer is. I don't know how to evaluate what the cost is going to be on both sides, because there's going to be a cost either way. The next part of your statement, we as Americans love to blame people for stuff going wrong, so regardless of the decision, because there's no perfect solution, someone is going to be blamed for all that went wrong. And I here 1,000,000% agree with you. I 100% agree with all of that. Something's going to be wrong and somebody's going to get the blame. And even if it was a conscious choice between two situations, I think this is where the messaging and explaining to the public is so important. This is where I think we need to have people have these types of conversations, and why I put this video out to begin with. Because I think there is an aspect of the right and left as being the focus, and not so much what is right and wrong for people in general, and to make that decision. And when they do, I'd like to believe as long as they have the data behind them to justify the decision and knowledge that they did what they thought was best for the people of the country, they'll be in a much better position than for people to assume they just want to win an election. And again, I wish that was true. I don't think for a minute that it would matter what the decision was, why they made the decision, how they made the decision, would change anything about the manner by which they're going to get blamed either way. Whether the economy is going to get hurt or people die. people are going to get blamed. And sadly, that's the nature that we're in. We are a society that likes to blame. We like to hold people accountable, not realizing that there are going to be mistakes, things are going to go wrong, and that sometimes it's nobody's fault. Sometimes you just don't have the right answer because of the situation. You're stuck between a rock and a hard place. And then, who's to say to somebody else, well, we made this decision and now you lost your grandmother or you lost your father or brother, and say, well, it was better economically for the society. And then they're going to be angry. Or say to the person now that can't feed their kids, can't pay their rent, and say, well, we saved these people's lives, so you have to go broke and lose everything. Again, these things are very difficult. But to say that we cannot have an opinion, that somehow we don't have this ability, I don't agree with. I think actually we as people are very intelligent. We have the capacity to learn. We have the capacity to understand. And we have the capacity to make decisions. But when we get the facts, one of the most beautiful things about this country was the idea that we're supposed to debate ideas and issues so that the masses would have the ability to make choices about who they think would be better. I think one of the reasons why we are stuck with some of the choices that we've had politically over the years is because that debate has been diminished greatly. People don't debate. People don't put out facts about why they think one person is better than another. It's my team is right, your team is wrong, and it doesn't make a difference. And don't confuse it with the facts. I think it was one of the late night shows that used to go around and they would say to people, do you agree with this position or this position? And they would switch around who the person was that held the position. I think this was when Barack Obama was running against Mitt Romney. I believe that was the case. And they would say like, Barack Obama believes this and Mitt Romney believes that. And meanwhile, it was the opposite way. And then the person was saying, yeah, well, I agree with this. And then whatever party they believed. And then they would say, well, actually, that was switched around. Oh, really? And then most of them still went back to, well, I'm voting for that person anyway. It didn't make a difference. And that's the problem of the way that we make decisions today. I find that we're not taught to think and to analyze. We're not taught to see two sides of a situation and start asking the tough questions and to come up with an answer. And this is a failing in our education system. It doesn't teach us to think. It teaches us to be good sheep. And that's not good for any democracy, because good sheep get led to the slaughter. I hope that you found this video helpful. I hope that you'll hit like if you like it. If you disagree with me like Jen did, please tell me why. And again, if you'd like to become a patron to this channel, hit the Subscribe-star link below. I wish you a good night and good mental health.